hardest task for a soldier is to remain quiet under fire without replying. Add to this the concentrated thought and delicate nicety of touch necessary to the treatment of mortal and agonizing wounds, and you have the task which confronted the army surgeon on the field of battle. The photographic history of the Civil War.
Medical professionals served on the front lines of the Civil War and were crucial to the success of the troops. While their efforts were commendable, over 600,000 soldiers lost their lives during the war. Many of these deaths are attributed to the lack of knowledge of surgical cleanliness at the time. About 1 out of every 7 soldiers that underwent an operation did not survive it. Civil War surgeons used anesthetic for many procedures.
The most common use of anesthesia would have been to perform amputations, but it was also used for some other things in the treatment of shell wounds and bullet wounds where pieces of shell or pieces of a bullet had to be removed.
The most common anesthetics used were chloroform and ether, which were doused on a cloth and held over the mouth and nose of the patient. In field hospitals, such as this one in Gettysburg, amputations were performed in the open air rather than in the dark tents. There were 3 common types of injuries during the war: incised and puncture wounds, miscellaneous accidents, and gunshot wounds. Of the approximately 170,000 wounds to the extremities received among Federal troops, about 30,000 led to amputation. This amputation kit belonged to Dr. William Longsdorff and was used during the Civil War to operate on soldiers. This kit includes various scalpels, saws, and other instruments to aid with surgery. William Longsdorff was born in Silver Spring Township and served as a major in the Union Army. He graduated from Dickinson College in 1856 and later went on to Jefferson Medical College in Philadelphia. In 1861, he enlisted and became a first lieutenant in the 9th Pennsylvania Cavalry. Longsdorff had a fine military career and served in over 80 engagements during the war. He was discharged in 1864 after falling off his horse and breaking both ankles. After returning home to Cumberland County, Dr. Longsdorff married and had 5 children. His eldest daughter, Zeta, was the first female graduate of Dickinson and also went on to become a doctor. In the absence of permanent hospitals, many churches, schools, and private residences were used to care for soldiers.
A hospital in the Civil War was simply a place where someone could get temporary comfort. It was not a specialized hospital. It was somebody's home. It was a public building, such as the dormitories at Dickinson College or at Gettysburg College during the Battle of Gettysburg. It might even be the outbuildings on a farm.
Injured soldiers were taken to both the Old East and Old West buildings on Dickinson College during and after the occupation of Carlisle. John Kagi Stayman, a professor of Latin and French, wrote to a student in July 1863 about the shelling of Carlisle.
The hospital in the college is but a temporary arrangement. It will be removed in due course to cleanse and ventilate the building for the fall session.
When students returned to campus for the fall semester, the patients were moved to private residences. After being moved, 1 soldier died in the home of Jacob Ream, a trustee of the college. Although the Confederate troops left Carlisle in July of 1863, the legacy of the Civil War continues to live on 150 years later.